Welcome to the PharmaVOICE Editors Take video series, filmed live at the 2011 DIA annual meeting in Chicago. Hosted by Taryn Grome, editor of PharmaVOICE. In this session, Taryn meets with Stephen Webb, President, North America, for REGISTRAT-MAPI.
Stephen, it's nice to see you again. We're hearing more about measurement-based care recently. Can you explain how measurement-based care works and why it's important?
For certain diseases like hypertension, for example, measuring effectiveness is more relatively straightforward. We measure blood pressure. For hypercholesteremia, diabetes, we measure cholesterol, glucose levels, hemoglobin A1Cs. For other diseases like chronic pain, for example, which may be more complex, they really require patient-reported outcomes. And we're able to use those data to gather those data in a more consistent way to then provide a more accurate measure of various aspects of the disease. And then these data can be used to provide data for more informed treatment decisions and improve outcomes. And the Institute of Medicine also recommends that we use these validated tools, clinically meaningful assessments, to make clinical care decision making as a key component of continuous quality improvement.
How do you collect and disseminate these data so that it may be useful to clinicians?
We're involved in a variety of initiatives, measurement-based care initiatives, where that include routine assessments of patient symptoms and side effects. And we're able to take these and provide clinicians longitudinal patient profiles that include comprehensive assessments that provide a more accurate measure of patient symptoms and outcomes, and in comparison to what most clinicians rely on, a global assessment by the clinician and patient. So it's a more accurate measure, and we're able to take these data and then allow these clinicians to compare their own data within their practice to all the data, the identified aggregate data, so that they can see what they're experiencing anecdotally in their practice, how that might be validated or compared to other clinicians and patients.
So how does measurement-based care align with certain initiatives such as pay-for-performance and comparative effectiveness research?
Well, measurement-based care is really a key component of assessing performance and at the core of comparative effectiveness research, particularly as it relates to patient-reported outcomes or different clinically meaningful assessments that we would collect, as I alluded to earlier. So these data can provide a more accurate assessment and allow for measurement-based care, and we hope that actually trends into value-based care, because the concept is that these will improve treatments and outcomes and hopefully also thus reduce costs. These data may also be able to be utilized to identify predictors of better outcomes. And then we also provide these data to societies, and societies are able to develop different evidence-based treatment guidelines to provide clinicians algorithms and so forth.
Additional Editors Take videos, as well as podcasts, white papers, webinars, and more, are available in the resources area at www.pharmavoice.com.